Great. Well, thank you all for joining today. My name is Sara Cariano. I'm the Senior Health Policy Analyst here at VPLC, and I will be talking about Medicaid Unwinding today. So thank you all for joining. I think we're all pretty accustomed to Zooms and webinars, but go ahead and feel free to put questions in the chat as we go. If I see them, I'll try to answer them. If not, I'll get to them at the end. And also, just so everyone's aware, the webinar is being recorded, and we will send the recording as well as slides out after to anyone who registered. So with that, I'm just going to go ahead and get going. Okay, so as I said, we're going to be talking about Medicaid unwinding, some updates, things that have recently changed with federal legislation that passed at the end of last year. I am Sara Cariano. I work at the Virginia Poverty Law Center, where we advocate, educate, and litigate to break down systematic barriers that keep low-income Virginians in a cycle of poverty. I focus obviously on healthcare with a lot of Medicaid and ACA work. And then I also help administer our Enroll Virginia program. So later on in the presentation, I'm going to talk about application assisters. One set of application assisters are navigators. We have navigators, as well as Boat People SOS in Northern Virginia have navigators. And we provide assistance and education for unbiased and for free with Medicaid as well as ACA coverage. So it can help people who are going to have to transition in the upcoming year. So we're going to start with just a little background. Some of this is probably familiar to folks who have been following this or have done one of the webinars I've done in the past. But way back in March of 2020, the Families First Coronavirus Act was passed, and it provided states with an additional 6.2 FMAP, or kind of the percentage of the Medicaid costs that the federal government spends. Usually Virginia is about a 50-50 split. So during this time, it's been a 56 on the 56.2 from the federal government, the remainder that the state is paying. To be able to pull down, to be able to get that extra funding, however, states had to prevent or not put into place any new restrictive eligibility rules or procedures, so not make it harder to get Medicaid or CHIP coverage, not increase or implement new premiums for Medicaid or CHIP coverage, and they could not terminate or reduce anybody's coverage, right? So even if someone was now not eligible based on the eligibility criteria, traditionally they would come off, say their income went up. They said you have to keep them on. You have to keep them on, and it was tied to the end of the public health emergency, the COVID-19 public health emergency. And lastly, Medicaid programs and CHIP programs had to cover COVID testing, treatment, and vaccines.
Hey, Sarah.
There were Yes.
Sorry to cut you off. We can see presenter mode right now in PowerPoint. So I don't know if you want to try to X out and then re-enter the presentation.
It worked before. Let's try this one more time, see if I can get it. Try one more way, and sorry about that, everybody. Getting on my computer now. Doesn't. Mara, is that better?
Yes, it looks good now.
All right, sorry about that, everyone. I can talk about Medicaid all day. Technology not always my friend, so thank you for your patience. So there were a few exceptions to this, which are still in place. If someone moves out of state, if they call in and say, I want to terminate Medicaid, or if someone passes away, their coverage could be canceled. And then if for our CHIP populations, which we call kind of famous in Virginia, When they reach kind of the end of the eligibility criteria for a category, when children unfamous turn 19, when pregnant individuals, unfamous moms hit 12 months postpartum, they could also lose coverage at that point. And then our legally residing individuals, children and pregnant women, regardless of income, once they also were 19 or hit the end of the postpartum period, they could be removed. So unless they met the more restrictive qualified immigrant eligibility rules for non-pregnant adult non-citizens to be eligible for Medicaid. So these small groups could still be losing coverage. I will say it didn't always happen. So I'm not sure how kind of consistently the state and the local DSSs were actually removing all of these people from coverage. So I had cases where people definitely were removed from coverage. And then I've seen cases where other folks were kept on. So I think it was a little bit disparate how this was actually implemented over the past 3 years. So, that passed in March of 2020. And then, over the next 3 years, CMS has released a good bit of guidance over what the states were needed to do once the public health emergency ended, how to get kind of back to the normal operations, which we affectionately call the unwinding period, right? Once all these protections go away, we got to get back to normal. And so we call that unwinding. And so the guidance that was released in relation to that, the Families First Coronavirus Act provisions, said that no terminations could occur unless there was a full renewal on somebody. So they needed to go through the whole case, the whole process for renewing. The only exception is if someone had been found eligible or renewed within the last 12 months. So we knew that they had an active current case. So a change was kind of a change being reported on some fairly recent information versus a change being reported on 3-year-old information. They're saying, nope, you got to review the whole case. You got to get all the information again if it's an overdue case. States are given 12 months to get through this process to initiate all the renewals. And then they have 14 months. So they get those extra 2 months at the end just to clean everything up and make sure all the renewals have been completed. They were told they were not allowed to initiate renewals that could result in a termination any more than 2 months before the month after the PHE ended. So we'll get into kind of the details of the timeline once we get into the new provisions associated with the Consolidated Appropriations Act of last year. The FMAP, so that extra money that the states were getting was set to end at the end of the quarter that the public health emergency ended. So if the public health emergency ended, say today in February, well, the end of the quarter is the end of March. So we could get that extra boost just for that extra kind of month and a half. And then CMS really strongly recommended that the renewals be dispersed as evenly as possible throughout the year. And they said that there would be some mandating reporting, but there were not a lot of details released on that. And there was no confirmation or commitment to making what the states were reporting to CMS public. Enter the Consolidated Appropriations Act of 2023. So this was signed into law at the end of December of 2022. And it made some really significant adjustments and changing. So where previously the continuous coverage requirement was directly tied to the public health emergency, it ended when the public health emergency ended. The Consolidated Appropriations Act delinked that and said, we're not going to be reliant upon the extension of this public health emergency or not. We are going to say that these continuous coverage provisions are going to end at the end on the last day of March of 2023. So we now have a hard deadline. These continuous coverage protections are in fact going away, and they will go away really effective April 1. It also fades out the FMAP. So they were worried, I think, a little bit that states, as soon as they stop getting that money, we're just going to try to kind of purge the rolls as quickly and as easily as possible. And so CMS has been saying this whole time, we want you to kind of go methodically. You're still required to follow all the federal regulations around renewals and redeterminations. And so now they're giving states some extra funding for an off-ramp for that period. You can see here the chart where that kind of, you can see where and when it steps down. The budget, because Virginia is going through a budget process right now, the state has estimated that'll bring in an extra $100 million over the course of that 12-month period that we hadn't anticipated. So that does kind of, again, help and hopefully alleviate any political pressure to reduce the rolls quickly and in a way that would likely result in a larger percentage of administrative closures for individuals who are still eligible. It also kind of guidance has come out and confirmed that much of the requirements that were outlined previously from the Families First Coronavirus Act initial kind of implementation of this continuous coverage protection will remain in place. So the eligibility standards, methodologies, procedures, again, can't be more strict. You can't implement new premiums. You have to cover the COVID testing and treatment. And because that's tied to the FMAP now, they say you have to do all of those things until the enhanced FMAP goes away, which means instead of these protections ending a month after the PHE ends or 2 at most, it'll go all the way through the end of December of 2023, right? So these set of protections have actually been extended out through the Consolidated Appropriations Act. We also still have to comply with that kind of 1-year timeline or 14-month timeline to process all the renewals. And then instead of just saying, okay, the terminations can't occur before the end of the public health emergency ends, now we're saying the terminations can't occur before the end of the continuous coverage provision. So they can't occur before March 31st. And again, we can't initiate renewals before kind of 2 months. And so what that means is the earliest a state could initiate a renewal that would result in a termination of coverage would be February of 2023. So those are like the hard deadlines now, right? So when we were talking about this previously, we'd always be like, well, if the PHE got extended to this month, then work our way back and work our way forward. Now we know that these are the dates. They also added a lot of language about the states being required to do their very best to get updated contact information for all enrollees. And then language around returned mail. So traditionally individuals who where mail is returned, particularly if like a renewal package is sent, their coverage would just be terminated. The Consolidated Appropriations Act and related guidance now says that the state must attempt to contact them in more than one way, or at least 2 ways, outside of mailing that packet. So if a forwarding address came back, they could mail the packet to the new address. If they have an email or phone, they could call or text or email to meet those two. If they meet the first kind of set of rules around doing their very best to get contact information, and they still don't have 2 ways to contact that individual, then they have to note that in the plan that they're providing to the federal government about how they will go about unwinding. And that kind of gets them out, gives them that out if there are individuals or families that they just don't have the contact information for, even though they've tried to get it. The CAA also kind of defined more clearly the data reporting requirements. You can see a list here of things that states are going to be required to report to CMS. It also said that CMS does have to post this data publicly. Now we've heard from CMS that it's probably going to take a couple months from when they get each monthly report to when they post it online, which is unfortunate because, if you're getting it 3-4 months down the road, it may not be as helpful as you're trying to advocate through the unwinding process to make sure that your state is not doing anything it shouldn't and keeping an eye on how things are going. But at least it will be public. And it's also not kind of granular. So we were really hoping for a little more detailed data on age or category of coverage, race, ethnicity, language, kind of preferred language, so we could see if there were any particular demographics or populations within our state that were getting disparately impacted by this process, or there are a lot more kids getting kicked off coverage than anyone else. Those are the types of things that we would like to know. And unfortunately, CMS has not kind of gotten that granular in the data that they're requiring states to report to them. And lastly, it put in some compliance provisions. They added a little bit of a stick to states, right? So the extra FMAP, it's saying we'll give you a carrot to do it properly. We're going to give you some extra money and continue that on. But if you still don't do these things properly, then we now have kind of some sticks to take money away from you. So the first is states who don't comply with the reporting requirements. So this monthly report from July, so they're giving them a couple months to get up to speed on it, through June of 2024. they'll see their federal FMAP actually decreased 0.25% for each quarter that's not reported, up to a full percentage point. And this is regardless. So if a state chooses not to comply with all kind of like the rules that I set out before for unwinding, they can do that. What happens is they forego that enhanced FMAP. So they have to give up a lot of money. Even if a state has chosen to not follow those rules and give up the enhanced FMAP, they're still required to report. And if they don't, they will see a reduction in their base FMAP for this period. So they not only will not be getting the extra money, they will actually be getting less money than their regular match from the federal government. Second, if states fail to comply with just the standard federal redetermination requirements, or are still not reporting their data, the Secretary of the U.S. Department of Health and Human Services can ask them for a corrective action plan. They have 14 days to submit it, and then once it has been approved by CMS, 14 days to implement it. If they do not submit it upon request or implement it once it has been approved within that time frame, CMS now has the authority to impose $100,000 penalty per day that the state is not in compliance, and that would be in addition to the reduced FMAP. So there is kind of some actual skin in the game from the state's perspective if they're not going to do these things, that they could be held accountable by the federal government. So those are kind of the overarching umbrella of like, this is what the federal government is saying now. These are the things that have changed. What do we know about what has happened in Virginia, what's going to happen in Virginia? Well, we know that we have over 2.1 million individuals enrolled in our Medicaid and CHIP program, which is by far the largest enrollment we've ever had in these programs. Certainly the continuous coverage requirement had a great deal to do with that. We also only expanded Medicaid for adults in 2019. And so that really dovetailed into this, the continuous coverage requirement. And so we've maintained people, but we also were still reaching and gaining people who didn't realize they were newly eligible for Medicaid prior to January 1 of 2019. The state has estimated that 14% of that 2.1 million individuals, of those 2.1 million individuals, will lose coverage during the 12-month unwinding period. That's about 300,000 individuals. I'll note there are a lot of national estimates peg that percentage at a higher point. So hopefully we do better than the national average, but we'll see. We'll see. They also estimate that an additional 4% will lose coverage and then come back in. So this is our kind of natural churn where people lose coverage at renewal. They don't realize it. They go to the doctor. They're not insured. They go to the pharmacy. They can't get their prescription. They reapply. They get back into coverage. So that's kind of an additional 4% of folks that they think that'll likely happen to. And then, one thing that I think has been on my mind a great deal, and that is going to probably be a challenge for our state, is that our local DSS offices do most of the all the renewals at this point. They're going to see a significant increase in their workload because they have not had to be doing renewals for the last 3 years. And this comes at a time where they've seen exceptionally high turnover during the pandemic and an average vacancy rate in eligibility workers of about 15%. Some locals are much higher than that. And so I think the stress on the local Department of Social Services offices is going to go way up. And I think there's some concern that it's just going to be too much work for the capacity that they have, at least in some localities. What the timeline that Virginia is doing. So you may recall that states are allowed to start renewals in February. That's the earliest they're allowed to start. In Virginia, we're going to start the renewal process in March. So if you see here, March is when we will kind of initiate that first round of renewals. That first of the 12 months where we're going to initiate renewals for all of these 2.1 million people. In theory, someone could be closed in April. I think that is going to be a pretty small number, simply because, as we'll go through later, the federally required full renewal process takes longer than 30 days to get through. So anyone with an overdue case, anyone who responds with some new information, or the state is requesting additional information, the process just likely won't be done until after April 30th. So then that kicks off kind of our 12 months. So we will start in March, which means February of 2024 is when we will should initiate the last month of initiating renewals. And then we'll have March and April of 2024 to complete those renewals, do any cleanup work, and hopefully be back to quote unquote normal within the Medicaid processing world. So when we talk about having to go through the entire renewal process, this is just a very high level overview of what that process actually is and why it likely wouldn't be able to get done for many people by the end of April, even if initiated in kind of mid-March. The first is an ex parte renewal attempt, which is an automatic renewal where they try to verify using existing data sources. If that is not successful, the state will send a renewal package, and that individual needs to complete it and fill it back out. And then if the state needs more information, they can actually even then send an additional verification request to that individual. If it is not sent back, or if the person sends back information that indicates that they're no longer eligible, they'll either be terminated or possibly reduced into a limited benefit program. So like Plan First has a higher income limit than Medicaid Expansion, which is full benefits. And then Plan First is family planning services only. And then even if they're terminated, there's a 90-day reconsideration period where someone can kind of come back and return that renewal packet and still have it processed as a renewal versus having to do a full new application. So as I said, the ex parte renewal is this automatic process. In Virginia, we have a pretty good ex parte rate when it comes to our categories of Medicaid that do not have assets or resource requirements. So who are they? Those are our kids, our pregnant individuals, our Medicaid expansion group. That's a pretty high success rate, 75 to 80%. And those ex parte enrolls have actually been happening behind the scenes during the last kind of year and a half, 2 years of the federal public health emergency to try to keep as many cases current as possible. What wasn't happening is that when someone was not able to be renewed through the ex parte process, they weren't sent a renewal package. They weren't terminated for no longer being eligible. It's just that the cases that were successful were kind of kept up to date. And that has helped us keep at least some of our cases current versus just every single one of them being overdue. It can also result, and the whole renewal process, it's really true for the whole renewal process, is if you are in one category and you're found no longer eligible for that category, say you were 17 in 2020, and now you're 20, you're no longer eligible in the children's category of Medicaid, but they'll check your eligibility in Medicaid expansion and the other adult categories. So you could end up being renewed just in a different category of Medicaid, not just the category that that person is currently enrolled in. The success rate, again, for cases that have not been successful through ex parte the first time, they'll try it again the next year upon that renewal date again. But they have found that with each kind of unsuccessful attempt, the rate of success goes down. And so the folks where ex parte has been attempted and failed a couple of times now, they're less likely to make it through ex parte, more likely to have to go through the more manual renewal process once unwinding begins. Yeah, and then, if you're renewed, you just get a letter that says, congratulations, you're renewed. Here's your renewal date, which is great. And if you're not renewed through ex parte, or you're not eligible for ex parte because you have an asset or resource limit in the category of Medicaid you're in, so individuals 65 up, individuals who have disabilities, who are receiving long-term care, they get a pre-populated form mailed to them. And it's really not a form, it's like a whole packet of papers. It's a lot of paperwork. And it asks you, we have some blank spots where we can get this information. We don't know this information, or the data that we got back is different than what we have on file. Can you fill this out? And the individual needs to go through and update the information that's there. So if there's anything that's incorrect, make sure that's fixed, and then kind of fill in the blanks, fill in any information that is missing. You can do this online at Common Help, especially if you have previously have a Common Help account and that's where the application was initially submitted. You can do a renewal, you can submit the renewal there. You can do it through the Cover Virginia call center. So you can just call in and say, I want to do my renewal over the phone, and they'll take the application and the information over the phone. And you can mail it or drop it off to the local. So through mail or in person as well, completing that packet and turning it in. We do recommend that if there is something that has changed, it can be valuable just to turn in the verifications at that point in time. Here's some pay stubs for my new job to show you that this is in fact my new income, versus turning it in and then waiting for them to request a verification and having to send that back. And so trying to be a little more forward thinking when someone is completing a renewal can help the process go more smoothly for them, as well as for the local DSS or the entity that is processing that renewal. If the renewal is not sent back, so if they just don't respond, or if the renewal is sent back with information that shows that I submitted my new pay stubs and it's like, oh, you're over income, you just earn more now, so you're no longer eligible. They'll be sent a termination notice that needs to be mailed. It's 10 days and 1 day for mailing, so 11 days prior to the termination date. So if I send my packet back and the eligibility worker gets it is processing it on the 28th of the month, I will be terminated. I will get coverage for the whole next month, because there's no way that they would be able to mail me a notice and print me a notice and give me that 10 days notification that I have to have. And because our coverage in Virginia always ends on the last day of the month, it would kind of bump it out all the way to the next month to make sure that that notice requirement is met. It needs to require the termination and reduction notices have to tell you why you're losing coverage. I will say a lot of times in Virginia, these are very high level. They don't give you really a lot of details that I wish they would, and in some states they do. And it has to include information on how to appeal. So if you believe that they looked at your income wrong, you say, I submitted my pay stubs and they calculated it as if I got paid every week and I really get paid every other week, so my income was estimated way too high. You can appeal that. You can call the worker and ask them to reprocess it. In all honesty, sometimes that's easier too. And then if you turn it in and there's information and you're found ineligible, you don't have the reconsideration period. But if you don't return, if someone does not return the renewal package, or if they don't respond to the verification requests, they do have this 90-day period where they can turn that paperwork in and be processed again as a renewal versus a new application. If someone is found ineligible, they can either appeal, you have 30 days to do that, or you can submit a new application. And so depending on why the person has been terminated, what that notice says, that might dictate the way to get back into Medicaid if you think, or we think, that individual, that family is actually still eligible for Medicaid. Again, you have 30 days for an appeal. Now, if you have good cause, if you say, well, I didn't get my notice, mail got crazy and I didn't get my notice until day 28, and here's the postmark on it. And so you didn't file your appeal until day 35, you would have good cause to kind of get that appeal in late. You can request your benefits to be continued during the appeal, either called continuation of benefits or benefits pending appeal. That has to be requested before the termination takes effect or within 10 days of that notice. And so there's a pretty tight timeline for requesting those benefits. I will note one of the other protections that is still tied to the public health emergency is that enrollees were automatically getting benefits pending appeal. And that because it was automatic, it also came with the protection that if they lost the appeal and were found ineligible or found to, have services reduced and that reduction was upheld in the appeal process, there is a risk that you will have to repay for those services or repay for the benefits that you were found ineligible for. That risk, that liability was done away with during the public health emergency, and those will come back. So these are some other new considerations that we'll have to kind of think about as we're moving back towards the kind of normal Medicaid processes and procedures. And just to note, the state does have to accept new evidence during an appeal. So if what they had at the time looked like the person was not eligible, but then you're like, well, I lost that job and now I'm only working part-time and here are these pay stubs. They have to look at that new evidence. They can't just say, no, what we had showed it, so you're still denied and terminated. They have to look at kind of what is presented to them and what is currently accurate. So these are kind of the, out of my head, what are the most likely kind of list of things that are going to happen to folks upon renewal. First, your coverage is renewed. Great, fantastic. You're still eligible. You don't have to worry about transitioning, all of those wonderful things. An individual may be renewed just within the same category of coverage, or they may be renewed into a different category of coverage. If someone is moving, like if someone has turned 65 while in Medicaid expansion, so if someone is moving from a category that does not have an asset resource test to a category that is, they are going to get this whole Appendix D asking for that information before they can be renewed into that new category of coverage. And while all the full benefit categories are very similar, there might be some variations between some of them. I actually think the last couple of years, the legislature took care of a lot of the little things that were different and with preventative services and things like that. But there might be just little tiny variations in the full benefit categories. The second large category of things that could happen is if someone has their coverage reduced or terminated. So when I say reduced, I mean being moved from a full benefit category of Medicaid to a limited benefit of category and benefit category of Medicaid. So someone could be terminated or reduced, but still eligible. So if there was an administrative closure, so they didn't return the renewal packet, and so they just, the coverage got terminated because the state didn't know if they were not eligible, they didn't get a response, they closed the coverage. Or if there's an error, so if something just gets looked up wrong, or if there's some kind of error that results in that termination. They can be moved to a limited benefit category for kind of the same reasons. They could be ineligible and be required to reestablish eligibility. So if someone was in a category with an asset or resource test, their income is still within income eligibility lines, but their assets or resources have gone up above that limit, they might have to spend down some of those assets and then reapply to get back into coverage after they've reestablished, after they've newly again met those eligibility criteria. Or they're ineligible and they have to transition to new coverage, right? You're just over income from Medicaid expansion, you got to go to the marketplace, or you have to go to your employer coverage, or you have to go to kind of full benefit Medicare, all kind of options there. So, I think for most of especially we expect a lot, the state has said they expect more people to come off of Medicaid expansion than other categories. It is a group that tends to have more churn naturally, and people kind of coming in and out of employment or getting new jobs. And so I just kind of wanted to focus a little bit on the two places where most of those people will likely end up looking for coverage if they are no longer eligible for Medicaid. The first is the marketplace. So this, the ACA marketplace, where you can go, you can buy individual and family coverage, you can get financial assistance to help you purchase the coverage. They just announced that there is a new kind of really broad special enrollment period for individuals who lose Medicaid or CHIP during the unwinding period. Usually when you have a loss of coverage, you only have 60 days to enroll in a marketplace plan. Due to this new special enrollment period to get into marketplace coverage, it basically says if you lose coverage during unwinding or the couple months after, and you come in and you do a marketplace application and you say, yep, I lost coverage during those dates between March 31st and July 31st, and you're found eligible, so you still have to meet marketplace eligibility criteria, you can get a special enrollment period to get into coverage. So if it's been 4 months or 6 months, but it's still before July 31st, 2024, you can still get an SEP outside of open enrollment, right? Because usually with marketplace, you can only enroll during open enrollment, or if you have a qualifying life event to get you the special enrollment period. This 60-day time limit does come in after you've done that application. You have 60 days to choose and enroll in a plan. Most people do it like within that week. So most people are trying to get into the coverage as quickly as possible. So that shouldn't really be a challenge. This is automatically applies to the federal facility marketplace. So states that use healthcare.gov. But if a state has a state-based exchange, it is an option for them to implement this broad special enrollment period. Virginia is transitioning to a state-based exchange for open enrollment for 2024 plans. So likely kind of launching November of 2023 for 2024 plans, which, as you'll note, is kind of in the middle of this time frame. I think it's likely that we continue this, and I know Virginia is working really to make sure our launch aligns our state-based exchange as closely as they can with healthcare, with the federal marketplace, and make sure that's all running really well before we tweak it and change it to any kind of state specific things that we'd like. So I would hope, and I would kind of expect that this SEP would continue, but it is certainly something to watch and something that the folks at the Virginia Health Benefits Exchange will have to confirm, because I don't work there and I don't get to make those choices. And then just also note, if someone is moved into a limited benefit program, so if I get moved into Plan First where I only get family planning services, the marketplace considers that kind of a termination of coverage because you no longer have a full benefit plan available to you. And so those folks can also go into the marketplace. But it is not automatic because there's a lot of steps involved. You have to choose the actual health plan that you want. So Medicaid will let the marketplace know that this person is losing Medicaid, but that individual does still have to go to the marketplace and kind of actively do the application and choose a plan. And so it's a little more of a process versus if someone initiates an application on the marketplace on healthcare.gov, it will do a Medicaid assessment, and just we're a state where the marketplace can actually just tell the state to enroll you in Medicaid because they've found you eligible. So it's easier going in one direction than the other. Employer coverage. So some folks may have gotten a job and now they have an offer of employer coverage. Most special enrollment periods for employer plans are only 30 days, but there are some very special rules for loss of Medicaid or CHIP that apply to many, many plans. And so if you possibly would get a 60-day enrollment period for a lot of employer coverage plans, which is broad, but it's still only 2 months and some folks may miss it. Important to note, if you have an option of employer coverage and it meets what the marketplace considers is affordable, which is a little over 9% of your, a little under 9% of your total household income, then you can't get tax credits on the marketplace. And even if you miss your open enrollment or your enrollment window, your special enrollment here from the employer plan, and you're like, okay, well, I'll just go to the marketplace and get coverage until my next open enrollment for my employer plan, you can't get the financial assistance. And so if someone has an offer of employer coverage, it's really important that they get into that plan because there's probably not going to be a real affordable option for them and outside of that plan because they're not going to be eligible for financial assistance anywhere else. So this, again, these are very high level. I think if I sat down with someone who was came in, there's like, I lost Medicaid, what would I do? I'd probably ask these plus 20 more questions, but this is a really high level of like, what do we need to know to make sure we're helping people kind of get into the right place if they've lost Medicaid during this period, during unwinding. First, check the notice of action, that termination notice, and say, does it tell you that they lost it because they didn't return paperwork, or does it tell you they lost it because they were over income? What was the reason for the loss of coverage, the termination? Is everyone losing coverage or just some people losing coverage? The income limit for children is 205% of the federal poverty line, whereas for non-pregnant adults, it's 138. So we often see families where the adults are not eligible for Medicaid or CHIP, but the kids are. So we want to make sure we know kind of if someone's still in coverage, then the folks, who aren't, who we need to help transition. Did the state have the most up-to-date information? Do we think the state was using the right and most up-to-date information to make this determination? Was it an accurate eligibility determination? Or are we like, oh no, this was probably, I think they had old income information or old something information. We need to make sure that they have the new so that it is an accurate determination. And then has anything else changed? Kind of along the same lines. Has anything else recently changed that wasn't reported that would impact eligibility? We go through all those questions and we're like, you know what? This person lost because they lost their coverage because they didn't return their packet, but based on everything you're telling me, you're still eligible for Medicaid. Well, are we within 90 days? Can we do this renewal package? Are we within 30 days? Do we need to do an appeal? Or are we outside of that window and we need to do a new application for Medicaid to get you back into coverage? Medicaid, not CHIP programs, but Medicaid can be retroactive up to 3 months. So on the application, you can also indicate that you want to be assessed for that if there is a large gap in coverage and you want some retroactive coverage for an individual. If they're likely no longer eligible for Medicaid, we need to start kind of asking the questions about what other options are available to them. So first of all, when was your last date of coverage? So we know when it ended. So if we're looking at special enrollment periods, we'll know kind of where our starting point is. Is there an offer of employer coverage? Are you still within that SEP? Is it considered affordable? Okay, we can go there. If not, we can check out the marketplace. We don't want, we don't want to tell people, well, just go, if you've lost coverage, you're definitely eligible for the marketplace, because you might go to the marketplace and they'll ask you questions about employer coverage. They'll do a Medicaid assessment. And so while there's quote unquote, no wrong door, the marketplace will kind of send you back to Medicaid. What we see sometimes and what we want to try to avoid are people kind of getting in this revolving door, getting stuck between marketplace and Medicaid and just being sent back and forth. So if someone is likely eligible for Medicaid, making sure they're kind of going to the Medicaid agency and trying to get the enrollment there, versus, okay, you're, someone who's like, I don't know why I lost coverage, I'm just going to apply to Medicaid again. And then they sit down with us and we're like, actually, you're over income. Let's go ahead and go through the marketplace door to get marketplace, because it is a more efficient mechanism for getting that coverage, even though eventually you could get there through a Medicaid application. Kind of why take the long route? Okay, so I know at the beginning we kind of said we're not going to worry about the public health emergency thing anymore. We delinked continuous coverage from public health emergency, but there are some provisions, Medicaid provisions and flexibilities that are still tied to the public health emergency. And that's because during a federal public health emergency, Medicaid states can leverage emergency waivers through Medicaid. They can leverage what are called 1135 waivers, which are kind of broad program waivers, or Appendix K waivers, which generally apply to the home and community-based services pieces of the program, to kind of do away with certain things, right? So we used it to increase telehealth flexibility. We used them to extend appeal deadlines, these things that become harder for people to do, in-person services, in-person assessments during a public health emergency, right? We didn't want a lot of people in a vulnerable individual's home doing assessments because we didn't want to get them sick. And all of these waivers, just because the federal authority for it comes through the federal public health emergency, they're all still linked to the public health emergency. So you see the list of, these are just a few examples of things that are have been approved through these waivers. The link at the bottom is a pretty recently updated document where it tells you, as far as we know, this is now that we know, because the public health emergency has been set to end on May 11th, when certain things will end. Anything that was through the 1135 waiver ends when the public health emergency ends. It's not allowed to be extended beyond that. Items that are tied to the Appendix K waiver can be continued for up to 6 months, but no longer. So the state has a little more flexibility there as to when to add those. But the best thing, if you're interested in these, is just going to that link, which again, we'll send out the slide deck. And it's this really kind of easy, clean chart that tells you what the flexibility is and when it will end, as far as the state knows at this point. And certainly there's still some things that are in flux, but it's that's the best resource for that, for sure. And then we have these new additional what are called 1902 waivers that the federal government has said states can leverage these and adopt some of these options during unwinding to help with the redetermination process, to make sure folks are still getting their due process rights through the fair hearings and appeal process. And so there's a list of several things states can do. The ones here are the ones that Virginia has affirmatively elected to up to this point. A lot of it has to do with being able to just update, making sure we're trying to update and get accurate contact information. So using MCOs, using the USPS return mail forwarding kind of database, things like that, to make sure we have the most up to date. One non kind of contact information related is that first one there, where we're allowing ex parte, so these automatic renewals when someone's original application has said, I have zero income and 0 data was returned from those electronic verifications. Well, if someone has 0 income, it's very unlikely to get data to verify a negative, right? You're not going to get anything from the VEC unless they recently lost a job that's saying, yep, this person was paid 0 last year. But under normal Medicaid rules, that individual has to attest to having 0 income each year upon renewal. So they cannot be electronically verified unless there's some data that returns that confirms what they have put on the application. And because they didn't fill out the application right now, right, it's renewal, their attestation is old. And so for this period, we did adopt the option where we could allow that automatic renewal unless data is returned to show kind of that they do have income and it's this much. And then we need to go back to that person and get that information and make sure we have the most up-to-date information. The state has also applied for a waiver to waive certain assets accrued during the public health emergency. This is mainly for individuals who are receiving long-term services and supports and didn't have their patient pay adjusted. So patient pay is basically once you are approved for Medicaid and you can get either institutional care or home and community-based care, there's a second calculation that is done that says this is how much money you can keep for your regular cost of living things, your food, your whatever. During the public health emergency, that wasn't allowed to be adjusted. And so if people went from a home and community-based care situation into an institution, they were being able to keep a lot more money than they normally would. And so that kind of situations like that resulted where some of these individuals may have accrued some assets. And the state is working, they're currently, as far as I am aware, still negotiating this waiver with CMS to waive those for a certain period of time so that all these folks don't lose coverage and just give them a little bit more time to spend down those assets or resources in a proper manner. And there are kind of guidelines around what folks are allowed to do and not do. I'm not going to go into that now, but just know that there are a lot of rules around that. And then last, the federal government originally said pandemic related income. So like our stimulus checks or pandemic unemployment would be disregarded as income for the month that it is received and then disregarded as an asset for 12 months for the purposes of Medicaid. That is now changed to it will be permanently disregarded. And so if someone has gotten these kind of pandemic related sources of income and held on to them, those assets will be disregarded permanently. I have questions personally about how this is going to be operationalized, how folks are going to be able to verify to the state that yes, this $1,200 is from this check, and I held on to that, but not this. And so, there's probably going to be a lot of paperwork and confusion over how to verify that if someone is over asset. And so just be aware of that, and hopefully the state will provide some more solid guidance on that as we get closer to like a month and a half from now, getting close. And I do promise I'm almost done. So what has the state done so far? Kind of 3 buckets: enhancing their own capacity, reaching out to members, trying to get updated addresses and things like that, and reaching out to stakeholders. So folks who work with their members, folks like our navigators, making sure we know what's going on, and making sure we're providing feedback to them as well. Right now, there's also some budget proposals to hopefully enhance staff capacity, both at the DMAS contractor to enable them for the first time to process some renewals, which would be the only cases that are not associated with another benefit. So DSS has to process the cases where the family gets multiple benefits because it's a contractor is not allowed to touch those files. It's like too much information for them to have. And they also can't touch files where the individual has an asset or resource test. So just kids, Medicaid expansion, pregnant individual cases, but taking some of those out of the hands of the locals to give them a little breathing room. And then supplying some flexibility and overtime for local DSSs to try to increase their capacity as well. So what can we as partners do right now? So if we are working with Medicaid enrolled, CHIP enrolled individuals, just make sure they're updating their addresses, make sure we're telling them open your mail when you get it and when eventually it happens, because a lot of people just don't open their mail, unfortunately. If we know people are going to have to transition, help them plan. Connect with your local assister so you have someone to refer to down the road if you need to, if you are not yourself an assister and at an agency that has an assister. These are 3 groups I know that have folks across the state. I know this is not an exhaustive list. There's other folks out there who are doing this work. So, but these navigators, the certified application counselors, as well as the Healthcare Foundation, Medicaid enrollment assisters are all listed on the map on Cover Virginia. You can sign up for the DMAS newsletter just so you're getting updates from them. Virginia Healthcare Foundation also has really great sign up now trainings, which are Medicaid eligibility trainings that you can do online, modules, recorded modules, or you can go in person or do a virtual one. And so just brush up on Medicaid eligibility, because who doesn't want to do that on a Saturday afternoon, and just build relationships with your local officials, with DSS, with the people who are going to be tasked with doing this work, so that we have folks to reach out to when we need help down the road. And then in addition to all those things during unwinding, we can also help connect people who are having challenges with those assisters. We can track unwinding in our own communities and try to identify if any trends, if things are going well, great, or if there's trends where maybe specific populations are being disparately impacted, or we're seeing the same challenge over and over and over with multiple families, being able to get that back to kind of folks like myself or folks at DMAS. So because they may not have the eyes on the ground that folks like the assisters do, or people who are working in their communities do, the food banks, and so making sure we're working to get that information back to the state. So if something needs to be addressed, it can be. Reach out to the state and let them know if you need specific resources, specific topics that keep coming up that you can't find anything on, or specific languages that materials aren't being produced in that you need for your community. And then just, stay connected, remain engaged. This is going to be a really long process. It's going to take, I think it's just going to take, all hands on deck kind of effort. To prevent coverage losses, especially coverage losses for folks who are still eligible, or coverage losses for folks who can't figure out how to transition into the next type of coverage. And so hopefully we can all kind of not get too exhausted halfway through and just remain engaged in the process. And this is just a list of resources. So CMS has compiled all of their guidance, all of their state official letters, their data reporting requirements on one page. Cover Virginia has the DMAS Partners Toolkit, so graphics and letters and all things kind of ready for you to plug and go for social media and things like that, and FAQs, and so a lot of information there. DMAS also on the DMAS website has the Return to Normal COVID-19 page where they have a little more of that technical guidance. They have that, that's where the chart with where the flexibilities are going to end and the end dates and things like that are housed. And the last one is a blog from the Georgetown Center on Families and Children. The Consolidated Appropriations Act did a lot of things other than this, a lot of really good things for Medicaid. So like, for example, requiring continuous eligibility for children as of January 1st, 2024 for 12 months. And so if you're interested in just knowing the other like really good things that piece of legislation did, then you can go there. That blog's a pretty comprehensive list. And I will stop sharing now. I see that questions have come in. So let me hold that up. Is there data that shows renewal cases by zip code? No, if you go, not necessarily renewal cases, but if you go to the DMAS webpage, dmas.virginia.gov, there's a data tab. And you can see enrollment by zip code. And so you can see how many folks are enrolled. It won't tell you the number of renewals and the number of renewals by month, but that'll at least give you a sense of what of what that number is. Do we have a sense of how DMAS will be staggering these renewals, or will they even be staggering them? And are there specific renewals that they're sending it out to first? No. So CMS had said there's a couple different ways states could schedule their renewals. Virginia is just choosing to do the most overdue renewals first. So they're doing it by timeliness, and they are spacing it over the 12 months. And so I know that they have kind of a running spreadsheet where they're doing it as evenly as possible. It can be challenging to do it perfectly evenly because people are grouped together in cases. So my family might have my case might have 4 enrollees. And so while it's one renewal to process, it's 4 people. But they are trying to space them out as evenly as possible. And then they, in addition to that, all the current cases are being kept current. So if my renewal is up in March, right? If I have an actively current case and my renewal date is May of 2023, I will be part of that first March ex parte batch, because to get the process finished by my renewal date, they need to start that 2 months beforehand. And so anyone who has a current case they're gonna stay on that schedule. And then anyone who has an overdue case, they're going through the oldest cases first and working their way forward, as far as I know. And again, I'm not at the state, but that's what I've been told. Are there, yes, we'll be recording this. And Mara, am I missing anything? I think those are the questions that I see.
I don't see any other questions. I think you got everything.
Okay. I guess we'll give it 1 minute for folks to just put any last questions in. If not, I just want to say thank you all for coming and listening to me talk for an hour. So I appreciate your time. And do reach out. My information is in the PowerPoint. If you have questions, if you're working for a group that you think would like some information about unwinding or how to work with their community members, yes, please reach out and let us know if there's other information you want from us that you think would be helpful, so that we can start preparing that as well. And just thank you, Mara Geyer is the communications and marketing person with Enroll Virginia. She set up the presentation, she set up kind of the Zoom and was doing all the back end stuff. So just wanted to say thank you, Mara, for all your work to make sure that today went smoothly. I appreciate it.
Thanks, Sara. And yeah, like Sara said, we'll be sending the links and a recording and the slide deck after the fact. So just check on your inbox. That'll probably be later this week, because Zoom recordings take a long time to render. But keep an eye out for that, and definitely get in touch if you have any questions.